everybody? Joanna? I think, oh, Sheriff Gonzalez? Perfect timing. Thank you for being here. So what I'm just going to say is start about 3 minutes, and then I'm just going to call you to the updates. Say a word or two? All right, let's get started. I can't tell you how excited I am to be here today. You know, when I walked into this room this morning, it felt like being with family, and that's what I feel over the last several years. These initiatives that we're going to announce today really have been developed by a group of people who, like us, all of us in the county, are really committed to doing something about crime in our community and helping people who are suffering from behavioral health disorders. So today, we are here to discuss 3 exciting and important new initiatives that are going to come before the County Commission tonight. Every single one of these is focused on addressing a significant root cause of crime and incarceration in our community: substance use disorders. It's been demonstrated over and over that investing in prevention and treatment for individuals suffering from behavioral health disorders is more humane, more cost-effective, and more effective in stopping addiction-driven crime than arrest and incarceration. That strategy has been endorsed by individuals and organizations across the country and across the political spectrum, including the nation's most prominent conservative and progressive organizations, from the ACLU and NAACP to Americans for Tax Reform, the Koch brothers, and the National Commission on Correctional Health Care. The first administrative resolution we'll consider tonight will expand the use of the overdose reversal drug naloxone to individuals who are leaving the Metropolitan Detention Center or Bernalillo County's Department of Addiction Treatment Services. In the first 2 weeks after a drug user is released from jail, the risk of a fatal overdose is much higher than at any other time in his or her addiction. While someone who is overdosing can't administer the drug to him or herself, the medication will be available for others to administer or family members and friends. Correct Care Solutions, who contracts with the county, will distribute the naloxone to inmates leaving MDC who have been trained and educated about the use of this drug. We are really grateful to the Department of Health for their groundbreaking and relentless efforts to make naloxone more widely available in New Mexico, and we are really lucky to have their leadership in this state. The second administrative resolution will expand medication-assisted treatment programs available at both MDC and the DATS campus to include induction and maintenance of methadone. The use of pharmacological medications in combination with counseling and behavioral therapies is an established best practice for treatment of substance use disorders and has been endorsed by the National Commission on Correctional Health Care. In their position paper, the Commission stated, "Scientific evidence has firmly established that substance use disorders represent a chronic, relapsing disease requiring effective treatment with a view towards long-range management. Our position reflects this science and new national guidelines for treatment of opioid disorder and is intended to ensure that people with substance use disorders in custody receive evidence-based care." The third administrative resolution will establish an 8-member addiction treatment advisory board. The advisory board will consist of medical professionals and addiction specialists who will make policy recommendations to help align the county's programming, establish consistency, and ensure best practices for county-administered programs and services. And since I'm here, I want to tell you about another initiative at MDC that we don't vote on tonight, but is ready to launch, and that is the hiring of an on-site pharmacist to improve the distribution of medications to inmates leaving our facility. The initiatives that we vote on tonight are the result of years of work and input from literally hundreds of individuals across the state, some of whom who are here and many who couldn't join us. All share our commitment to reducing crime, making our community a safer place to live, and providing effective and comprehensive, compassionate services for our residents who are living with behavioral health disorders. And I think it's important to point out that every initiative we are announcing today and voting on tonight is being done within existing funding sources. So with that, I want to thank everybody who has come here to join us. Again, I feel like the people who are here are family. I've worked with many of them through different initiatives and meetings. So I just wanted to thank everybody for coming and give each of our attendees here the opportunity to say a few words. So I want to start with our new district attorney, Raul Torres.
I want to applaud the county, and I want to thank Commissioner Maggie Hart-Stebbins for her leadership on this issue. It's incredibly important for public safety that we recognize that treatment for folks in our community who are suffering from mental health disorders and who are suffering from addiction disorders receive the kind of treatment that they need. I have said time and time again that we will not incarcerate our way to a safer community. And while I fervently believe that there are certain individuals that we have to keep in custody, that we have to detain, that we have to incarcerate, we expend a tremendous amount of resources on nonviolent addicts, people in the system who would be better served in an alternative form and need access to the types of programs that have been announced here today. And I believe that by taking those people out of the system, treating them, and returning them to the community is the best way to make us all safer. It allows our prosecutors to focus our limited resources on the highest priority defendants and the folks that create the most havoc in our communities. And so I'd like to applaud the Bernalillo County for taking this effort, and I stand in strong support of this initiative. Thank you.
Sheriff Gonzalez?
Good morning. I also like to thank Commissioner Stebbins for her leadership in the county for this initiative. Obviously, we know there's no magic bullet for addressing all crime rates, but we believe this is a strong strategy and approach to address treatment and get help for people to people that actually need it and are willing to take that service. So thank you for that initiative.
Thank you, Sheriff. And next I want to introduce two amazing women who really were who sort of started me on this journey, Lou Duran and Jennifer Weisberg. Thank you, ladies, for being here and all that you've done.
Thank you. Thank you. My name is Jennifer Weisberg, and my son was 18 years old when he spent 30 days at MDC for a probation violation. He was released from MDC, and 4 days later, he died of a heroin overdose. So I think I immensely support this initiative, and I want to thank Commissioner Hart-Stebbins and everybody else who's worked to make this possible. And I think it's so important that we address this problem because, when you give somebody naloxone and help them, help save their lives so that they don't die from an overdose, it may be that moment in time that they seek treatment and they start a different path to a better life. Thank you.
I second all of that, and my son died 6 months before Cameron in February of 2011. We've come a long way. Thank you, Commissioner, for everything that the county has done to keep this national health crisis up front. It's no longer an epidemic. That word epidemic, I think it's thrown around a little too easily now. It truly is a national health crisis. And I believe it's 80 individuals were saved since April from the use of the medication. And that's 80 families that didn't have to bury their child or their loved ones. So I too support this 100%. My son, when he was released from jail a few times, one of the first things he did was, how am I going to get something today? So again, thank you for all of our departments that continue to make a difference for our families.
Thank you.
And so next I want to introduce Dr. Bill Weiss, who's been the co-chair of the Bernalillo County Opioid Overdose Accountability Initiative. And I think it's important to say that everything that is being announced today and many more initiatives that are being undertaken by Bernalillo County really came out of the work that was done by Dr. Weiss and all of the participants of the Opioid Accountability Working Group. So, Dr. Weiss.
Thank you, Commissioner Hart-Stebbins. When we started working on this several years ago, it was commonly stated by some that the MDC, the jail, was its own unique community within another community, but there was separation. I think what we have today is articulated a very different view of what the jail is, and what it needs to be doing. It's just the opposite. It's not separate from the community. It is very much part of the community. People going into the jail are involved with a criminal justice system. There are issues around that have to be respected. But one way or another, the vast majority of those people are going to be coming right back into our community. Person who has, many of these people have substance use disorders. That's how they got into crime in the first place. If that is not treated and they come back out into the community, we haven't really achieved anything. They're going to be still in the same position they were. So what has happened in the last several years is that there's been an alignment around the idea that that problem of substance use disorder, in many cases opiate use disorder, needs to be treated, needs to be dealt with, and that these people need to be given a chance, once released from the criminal justice aspect of their situation, to get back into the community, get some treatment, and get their lives restored in the community. To do otherwise doesn't do anybody any good, and we're really pleased that these steps are now being taken to allow that. And thank you very much, Commissioner, for providing the leadership to make this happen.
And thanks to Dr. Weiss, he is one of a group of addiction medicine specialists who have been reminding me day in, day out, this is something that Bernalillo County really needed to do. So thank you, Dr. Weiss. Dr. Bruce Trigg, who started our program, our methadone maintenance program 10 years ago, again, is one of those people who has consistently reminded us that we can do better. So thank you to Dr. Weiss and all of the addiction specialists who work with us. Joanna Katzman is among them. Dr. Katzman is with the University of New Mexico Health Sciences Center. Pain Center has been just a dogged, persistent, incredibly effective advocate for appropriately addressing substance use issues. So I'm really pleased you're here, Doctor. Thank you.
I'd like to thank Commissioner Hart-Stebbins for really bringing us all together today and doing everything that you've done to get us where we are today. And I strongly stand in support of all the programs that you've managed to get before the county and the state. This is just incredible. I direct the UNM Pain Center, where patients from all over the state are come for consultation for their chronic pain issues, and we try to screen patients as best as we can so they're not put on opioid medications, and so they're put on medications and they're treated with non-medication alternatives so they don't run the risk of becoming dependent or addicted to prescription medications, and then have less of a chance of becoming dependent or addicted to heroin, which is, as you know, has cost so many lives in New Mexico. What is so fantastic about Commissioner Hart-Stebbins' new things that she's doing at the county jail with giving inmates naloxone upon their release is that, as she said, that is the highest risk time for inmates to leave jail and then go and use heroin after they have decreased their tolerance. They're about 98% increased risk of dying in the first 2 weeks or first month after they leave jail. It is also, that's one of the highest risk times, and so take-home naloxone has been shown to be extremely effective. The other time is with medication-assisted treatment programs, giving patients in MAT programs and methadone treatment programs take-home naloxone is incredibly effective. As with what Commissioner Hart-Stebbins has done with Bernalillo County Sheriff and Manny Gonzalez, all his officers now are carrying naloxone in their units, and I cannot tell you how effective that is for law enforcement to be carrying naloxone and saving lives in our community. And I just appreciate that so much for what Bernalillo County has been doing. So thank you. And
I want to thank Dr. Katzman for her work. House Bill 370?
House Bill 370.
House
yes.
Bill 370.
It passed unanimously in the House and in the Senate, and it's just sitting at the governor's desk.
And so many of us have been active in trying to get that through the legislature and to the governor's desk, which we hope will sign it. But this is a bill that would actually require correctional facilities, treatment programs, and law enforcement across the state to carry naloxone. So I think we're taking the lead here in Bernalillo County, but we hope that through Dr. Katzman's great work and everybody who's been supportive of that bill, that this will be available statewide soon. Now, of course, at Bernalillo County, we could not do any of this without our great county staff, and we've had really wonderful leadership from two individuals in particular. So, of course, our county manager, Julie Baca, but our our behavioral health program director, Katrina Hotram, who has sort of been on top of this for many years, and Lisa Cedillo White, who is our head of our deputy county manager for administrative services, and I would just like to invite both of them to talk about their role in these initiatives and how they fit into our behavioral health initiative. Thank you, Katrina.
Thank you.
Thank you, Commissioner, and I'm really proud and honored to be here today talking about the Behavioral Health Initiative. As we go through the Behavioral Health Initiative, we often think of this as a 1/8 tax and how we're going to spend this money. And in reality, the Behavioral Health Initiative is more than that. It's about really providing and creating a safety net service that is going to allow us to address individuals in the community who have high needs, as well as people who are incarcerated. And this is one of those initiatives that, although it doesn't come out of the behavioral health tax, it's leveraging our dollars and current resources and providing opportunities for inmates and other individuals living in the community suffering from addictions to have another way to stabilize in the community, as well as reduce deaths in our community. So again, our approach for the Behavioral Health Initiative is a collaboration. We have partners in the community. We've got UNM Hospital. We have the City of Albuquerque and Bernalillo County. And we are focusing on 4 major areas: prevention, intervention, and harm reduction, supportive housing, crisis services, and community supports, what's happening in our community. The Opioid Accountability Initiative that Bill spoke about happened in 2013 based on the efforts and the leadership of Commissioner Maggie Hart Stebbins. And that was to start addressing the opioid use and the deaths, the high rate of deaths that we had in our community. Now, the Behavioral Health Initiative has partnered with the Opioid Accountability Initiative in order to move forward and implement recommendations that are leveraging what's already in the community. The first is medication-assisted treatment, and we're doing that at the jail through induction and the continued maintenance, and the maintenance program has been around for at least 10 years there, as well as making and increasing the availability of naloxone in our community. We have done this through partnerships with, again, the Bernalillo County General Services Division, which is a very unique way of us pulling things together. They've looked at all the contracts and all the resources that we're trying to expend on initiatives such as the Behavioral Health Initiative, and they grouped us together to say, how do we link these systems and make them work? So Lisa Cedillo White and her initiative really initiated bringing us together to talk about these things. The Department of Addiction Treatment Services, led by Carl Broach, the Metropolitan Detention Center, Bernalillo County Fire Department, the Bernalillo County Sheriff's Department, and the University of New Mexico Institute for Social Research, so they can measure our outcomes. The Bernalillo County Initiative, again, in this we want to reduce recidivism, improve public safety, and reduce crimes related to substance abuse, such as property crimes, and decrease opioid deaths. Now, there was a study done, it was called the National Treatment of Improvement Evaluation Study, done in the late 1990s, that evaluated individuals coming out of the jail, and those who were receiving treatment had a significant reduction in crimes and recidivism due to their crimes, arrest records, and they had more stability out in the community. These are the types of outcomes we are looking for. Now, of course, back in 2013, our own MAT program in the jail was evaluated. What we found there was the methadone maintenance group had a 46% chance of a likelihood of not being rebooked. So we are looking at improving these outcomes, not only with the induction over in the jail, but also on our MATS and DATS campus. In addition to that, the length of time before rebooking was around 9 months for this population. So we are looking to improve upon this and improve upon public safety. So again, our next steps are working on this advisory board and implementing this addiction treatment advisory board to improve our outcomes, to provide overarching policy to the county so that we have coordination of services, and to implement and assist us in implementing best practices. Now, the final thing I'm going to say that no one has yet said here is that MDC will be one of the first of its kind in the country to actually start induction of methadone. And so this is new and innovative, and we are looking forward to this addiction treatment advisory body in order for us to figure out the right population and how to administer this program safely. Thank you.
Thank you, Katrina. So one of the things I mentioned in my remarks was that each of these initiatives is being funded with existing resources. And I really want to thank both our county manager, Julie Baca, and Lisa Cedio White, who's our deputy county manager for General Services. Sorry. You know, it's really been Lisa and Julie who have looked at existing contracts, existing grants, to figure out how can we do this within the resources that we have. So I want to say thank you very much. I know this has been a lot of work for both of you, but really appreciate the efforts. So I think that ends kind of our formal remarks, but we will all be here for questions if anybody needs more information. Thank you.
Just a quick one, and awesome program, but where does the contact initiate? Is it, do I receive my treatment after I've been in jail, or is there a way of identifying the populace before they hit jail?
These programs that we're launching tonight, that we're voting on tonight, actually are for people who are booked into MDC. So right now, our existing program, if someone is booked into MDC, is identified as being in a community methadone treatment program. He or she will be offered maintenance. The exciting thing we're announcing today is anybody who comes, who's booked into our facility, who's suffering from a substance use disorder, will be offered the option of starting treatment in our facility. And an important aspect, our contract with the provider requires that they connect people receiving methadone in the facility, connect them with a provider outside the jail walls upon release, which is important in continuing that treatment. So, you know, that's the difference. Right, you know, we are looking at programs such as law enforcement assisted diversion that would actually divert people out of the criminal justice system, but that is not yet in place. We're working on it, but this is an important step that we feel it's an important intervention point when somebody actually enters our facility, an opportunity to offer another way.
You've called it an opportunity. Does it mean, could it be judicially mandated that someone, or does the patient client, do they have to require, do they require it?
It's voluntary,
Okay.
as I understand it. I can't speak to the judicial aspect of it. It's something I could ask and get back to you on that. But at this point, when somebody gets booked in, he or she will be offered the option of starting this. And again, purely voluntary, but it will be an opportunity if somebody's looking for that kind of help. All right. Again, thank you for coming. Thanks to everybody who came here this morning, who's been working on this, came here to support us, and we look forward to tonight.